Kōrero Prescriptions. Because kōrero is healing. He rongoā te kōrero. Nau mai hara mai ki tēnei paki here roki roki. Kōrero Prescriptions, made right here in the mighty Tūrangi. Where else would this sort of podcast be made? E te whānau. Kōrero Prescriptions is about having kōrero from different mātanga, I roto I te ao hauora. I tēnei rā, ko te kaupapa nui, ko tēnei mea te mate pukupuku. Nā, nōku te waimarie. We are so privileged to have Dr Leanne Te Karu here with us to wānanga this kaupapa. What is cancer?
Cancer is basically when the cells of your tinana don't listen to themselves anymore and they replicate at a rate that they shouldn't do. That's a very kind of broad approach, right? And obviously there's multiple different kinds.
Yeah, but it gives a good picture, eh? You kind of like can visualize these little circle things multiplying.
Unchecked. And in different ways, and growing into different places, and even in our bloodstream. So multiple ways. And cancer has been described by the Romans 3000 BC. So it's it's not This is not a new thing. No. Is the prevalence of it a new thing? It's certainly increasing in prevalence. We do know that, and multiple thoughts on why that's happening. Environmental, the way our environment is, and pollutants, etc. We know that smoking's part of it, but we also don't want to think that it's something that we should be judged about either. There's a very strong association with cancer and things like cardiovascular kidney metabolic disease. So we know that eating lots of red meat can predispose you to getting colon cancer, for instance. But that's not always the case, and that's not everybody. So you often hear headlines like that, and I don't think that we want to hold that as the single point of truth.
Yeah, well, this is the hard thing, is cancer doesn't discriminate. It will take hold in healthy people, in people who just eat.
Absolutely.
Perfect.
It does. And what we know for Māori is that in some instances we're less likely to get cancer, but we're still more likely to die. And then in some other types of cancer we're slightly more likely to get it, but we're exponentially more likely to die. And so even in melanoma, which is the second cause of cancer for non-Māori women, Māori woman, if we get it, we're more likely to die than non-Māori. How is that a thing? You're more likely to get palliative treatment than non-Māori.
So they go right there.
Yeah. So you get it, you add up all of those pieces and it ends up to be a significant difference.
Wouldn't that just make you feel like a number, eh? Like they see your life as having no value. You're just a number.
Well, and again, this was one of the things that I think is such a disservice in terms of thinking about unequal input to get equal outcome. Did some really great work. People like Nina Scott, and I've heard of her, out of Waikato. Maira Roka, they're both Māori, Māori hematologist, Māori public health physician. Amazing work around bowel cancer and why Māori should be screened earlier. So we were running throughout Taupo Tūrangi and into Waikato what we didn't think was a pilot, but a program where Māori was screened at 50, non-Māori at 60 because we've got very clear evidence as to why you would want to do that. It's diagnosed much earlier. So we thought that was something that was going to be rolled out elsewhere. You know, it wasn't a pilot. Subsequently, it was called a pilot and it was ceased. And what happens now is that everyone across the country is screened at the age 58. So it's not helping Māori at all. You know, that's we could show that, you know, that's going to mean more people dying.
What has the rongoā world done in terms of, you know, trying to make it easier for our whānau?
Actually, there is some good work at the moment. Auckland Hospital, Jonathan Koia, he's a surgeon actually, Māori anō. He has got rongoā practitioners working alongside him. Nina and Myra, who I mentioned, I'm doing some research with them at the moment, and they have a model of care. It's called the whiri model. So it's a wrapping around holistic care, you know, especially for us, say, in Tūrangi, where we might have to travel to an appointment. We might have tamariki that we might have to mind, you know, or we might be elderly, or say it was the test for the bowel cancer thing. You have to drink this terrible stuff and have an empty colon before you go for your test. You know, it's called a colonoscopy. So you don't want to be really travelling in between Tūrangi and Rotorua.
Yeah.
So they've got this model that looks at how you would view that and help people, awhi them, along that journey, and how we might be able to replicate that in other places as well. And I think these are the things that we need to be thinking of more broadly and keep advocating for.
Broadlands and Reporoa have a toilet, by the way, if anyone has. I know this from experience, from being hapu in the back of the car trying to get to Rotorua. Broadlands and Reporoa. But these are real life experiences for our whānau, because the distance is so great just to...
Absolutely, they are, and our tamariki too. Sadly, we've got tamariki here in the rohe with cancer, so they have to go to Starship. You know, that's the one place, so they've got to get to Auckland. And you talked about before the recompense that you're given, it certainly doesn't cover it at all, you know, or where you stay or the hotel at, you know, $100 a night, you know, hey aha, what, that's not going to cover expenses in central Auckland if you're lucky, Ronald McDonald House. But, you know, that's not always the case, and it's an absolute minefield to understand, you know, all of these terms and the, you know, that the oncologist or the surgeon might be using. It's he reo anō.
Yeah, I mean, there's English, and then there's te reo o te ao medicine. I was talking to Leanne earlier about how my brother and I, we are first language speakers of te reo Māori, and so English, when he was sick, I was having to translate for myself what these words of oncology and stuff meant, and then try and translate it to him. He mea anō te rai, medical literacy.
Absolutely it is. And it's almost cultural literacy, I think, Raiha. When I used to live on our beautiful Manawahi near Pihanga, I would have people come up the driveway on horses, waka, and, you know, asking just to translate things, you know. It might be an acronym. I once had a beautiful kaumātua come to me, and it had PND in his discharge letter from a hospital, and he said, I don't have postnatal depression. It meant paroxysmal nocturnal dyspnea, which is a flash way of saying you get short of breath at night, or, you know.
I was gonna say sleepy. Oh,
yeah,
wow.
So I mean, there's silly things like that, and if I could say to whānau, always ask, you know, clinicians, we use that kind of reo to talk to one another. We shouldn't be using it to talk to the people that were in front of us at all.
There you go, e te whānau, kau e whakamā, me pātai, tuku nā o pātai ki e nei tākuta. So, you know, there's a high prevalence of breast cancer here in Tūwharetoa. what are some of the barriers to treatment that we have here?
I think it's the identification to start with, right? So that regular screening, mammography, and certainly if there's been any whānau history, you'd really want to make sure that you're getting that screening earlier, because we've got really good ability to treat breast cancer now. That hasn't always been the case. When I first started out working at Waikato Hospital, goodness me, I think 1990 now, that wasn't the case. We used to look at things in 5-year blocks of to how successful a treatment might be, and that we know now that it's much longer than that. That there really is ability to get remission. So you want to identify earlier. It's that same kind of message I think Tale did with her, big program of Smear Your Mare. If you can identify these things and have them managed earlier, and they do bring the breast screening bus to the rohe. I know in various other places I've worked that, we've used kind of multiple ways of getting wahine along, and in Papakura we gave out lovers and had various kai and pink boxes, and I know they do things like that here too. And similarly in Whakatohia Rohe, they used to get all the nannies picking up people, and made kind of a day of it. I think it's that kind of early spot, and then not being afraid to advocate or to be the squeaky wheel type thing, or when will my appointment be and what will that look like? Some of the research I mentioned earlier with Nina Scott and Myra Ruka is having rongoā practitioners and what might be kaitaka wainga navigator type, in a Paki sense, a navigator walking that journey with you, but making sure that all of those messages were understandable.
So I know when my mum was going through breast cancer, she kept pressing that if she was going to have a mastectomy, that she would want reconstruction. They don't always offer reconstruction to everybody.
No.
So what do you think would bridge that gap? But where do you think the gap is in those types of situations, and what can we do better?
There is actually some good sort of research around that assumption around Māori women, and they won't be interested in a reconstruction. And you've already really answered it. I think Raiha is having that ability to advocate, but sometimes it has to be someone else, doesn't it? It's not always yourself, and you also don't know what you don't know, and you don't know what you're entitled to, but asking the questions of what I am entitled to.
They talk about having, we have these workshops in cultural competency, but we're not seeing the competency part. So what...
Yeah, it's been quite an iteration with cultural competency. Ngā mihi nui ki whae Tariana, that was really her by stealth move. There's something called the Health Practitioners Competence Assurance Act. It came out in 2003, and she managed to get in that kind of one word really, that cultural competence, and that all clinicians had to have a level of cultural competence, alongside clinical competence, and that they should be deemed equal. I guess the professions haven't been very good at measuring that, and also to reflect on that from a whānau perspective. It shouldn't be that the health profession is measuring or deciding or policing. Right. It should be the people in front of you who decide whether you're safe or not.
Yeah, just in a short space of time we've seen the advancement, I guess. Oh, well, I wouldn't say it's advancement, it's access to things like Keytruda and those sorts of rongoās in cancer. What can we attribute that to?
There's certainly a lot of scientific will to investigate and to research and to come up with therapies that are more accurate and more targeted. There's all sorts of things in the genetic space, CAR T cell therapy, a whole bunch of things, and things that we don't currently have in Aotearoa, although the Pharmac funding got a significant boost in the previous year. So another kind of 600 million towards medicines that we hadn't had here. There was quite a bit of mapping that was done, and mapping versus other countries too, to see what was missing and the gaps where they lie. So there is increased access to medicines that have got some deemed efficacy. And also what I thought was really cool was how those medicines are implemented.
Does it feel like you actually, like, you know, I mean, you have a full-time job that you're paid for, but as a Māori clinician, you know, the advocacy that you have to do is a lot.
It never stops, right? Yeah, because if you think of our whānau all the time, you know, and what they have to go through, you know, and why mighty ho that I get to be part of that journey too. But yeah, it doesn't stop, and it has to keep going at multiple levels. You know, you want to be on the ground to see what's happening there, you know, because, you know, we have to leave it better for our mokopuna.
We do.
Yeah, we really do.
I know that's something that our late ariki, Uncle Tumu, was very adamant about, that his mokopuna would have access to health care, and that would be the norm, rather than something you had to fight for and advocate for. Do you think we'll get there?
Oh, I hang my hat on that every day. Yeah, such a beautiful man, and, you know, it should be. He's right, you know, like at the moment I've been trying to develop some renal, so I'm National Clinical Renal Network, I co-lead that, and trying to have some renal guidelines. And, you know, in lots of places I'm hearing that it's aspirational. I said, this is not aspirational. This is core business. This should just be the right, you know. It shouldn't be anything that's deemed to be extra. Come on, this is baseline. Really should be.
I love that. It's not aspirational. This is core business. What would you say would be one of the key things that would get them through it as a whānau?
I love that bit that you said at the end, as a whānau. I think it's a whānau approach, and that's where I've seen some really incredible outcomes, where it's been the whānau ownership and the caring as a, you know, a whole whānau, and attending appointments, and everyone's got their own kind of little bit of piece of mahi in that as well, and no one's afraid to ask questions. Everyone is advocating. You know, you don't just need a single person in that space, but you really do. You shouldn't have to, but yeah, to use every one of those tools. There are some amazing, I don't know if the health system calls them navigators, but, you know, I kind of think it is the kind of kaitaka wainga type person, and you know, that they do have some really good knowledge of how the system works, because I think that's it. Sometimes the system doesn't know how it works either.
My brother was diagnosed with a sarcoma type of cancer. And we, as a whānau, decided that we were going to take a rongoā and medical approach. And so the aunties from Tāpena Kara, Auntie Rita and them, came all the way to Waikato to do poultice, because he was, you know, had swelling in the legs and holding water by then. And I feel like, you know, just having them around, the fact that, you know, he wahine kōrero Māori, ko takutu ngāne he kōrero Māori, that in itself was healing, and a rongoā, the way they explained what the poultice was doing. What do you think has been the place of rongoā with cancer treatment?
Every rongoā practitioner I've had the blessing of working alongside, Raiha always starts with wairua. So it was nice to hear your kōrero there, ngā mihi. What I really do want to say is that I think they can complement one another really nicely. So often you hear Western medicine approach say, oh, we don't want any of that rongoā. There's never been a time where I've seen that they shouldn't be used. We use the word contraindication and, kind of the Western paradigm a bit, but actually they can complement.
Yeah.
A one rongoā practitioner that I've worked with from Tauranga Moana, he's going through his own journey at the moment of bowel cancer and using both, and but making sure that knowledge is shared with both. Of course you're going to share it with a rongoā practitioner, but that doesn't always happen back at the kind of oncology end, at the cancer doctor end, because people feel like less able to share that information, and sometimes the response they get isn't always favourable. But like I say, I haven't had an instance where there has been anything that you shouldn't use together, and in fact they support one another really well.
Yeah,
I think
absolutely.
it's to be encouraged.
Ka pai. Yeah, because I know a lot of our whānau. I mean, and I've seen some who are just rongoā. But I think what the power is in the choice.
Yes, that option, and to really make a decision yourself. That is your tino rangatiratanga.
Tika. I'm really, really grateful that you came in to have this kōrero. And I think one of the biggest takeaways from this is you're right, it does affect the whole whānau. And the whānau has every right to be an advocate. Ngā tangata katoa kei roto I te rā rūma, e mea nui kia whai wāhi, te reo o e rā tāngata. Hei oranga mā tātou, no reira e te iwi. Tōna tikanga kua whaihua koutou iwi nei kōrero. Thank you for joining us on Kōrero Prescriptions. Tēnei mātou, kei raro.
He ara whakapiki ora is our opportunity now to put into action the aspirations of our people.
Really important because it's helping us to come together as providers for our whānau. So, not even that whānau, for our whānau. Kai mai.
We're either tū wharetua by whakapapa or we're tū wharetua because we live in this lohe. And so when you peel some of those layers back, actually the challenges become opportunities to come together as whanaunga and opportunities to work better together.
So our whakapanui is to support our kaumātua to access services.
I hope to see come out of it is that we actually be real, we be honest, and we look at each other as whānau, not as providers and all the dissections that we have.